This is something that you're likely to see on your exam. In fact, the composition of the cell wall is what creates the distinction between gram-positive and gram-negative bacteria. So, within the cell wall, there are a few key players we must identify. First, you have the capsule. We're going to draw the capsule surrounding this. Now, the capsule is a sugary structure which basically protects the cell against phagocytosis by neutrophils. Underneath the capsule, you have the peptidoglycan layer, right there, in red. Again, a sugary structure that gives rigidity and protection. So what makes a bacteria gram-positive or gram-negative? Well, if you remember from microlab, when you do your gram stain and wash, some of the bacteria retain the gram stain better, and these ones are called gram-positive. But why? Well, the thick peptidoglycan layer actually traps the stain in and doesn't allow it to wash out. So, gram-positive bacteria have a thick peptidoglycan layer. Let's say that's our peptidoglycan layer in the gram-positive, whereas gram-negative bacteria have a very thin, wimpy peptidoglycan layer. Here's another diagram of a bacterial cell wall. There are several key components to the cell wall. What do we call this space right here? That's called the periplasmic space. Good. And what is it an important source of? Well, the periplasmic space contains enzymes necessary for bacterial virulence, such as proteases, phosphatases, lipases, and beta-lactamases. Excellent. And just to recap, here's the inner cytoplasmic membrane, the peptidoglycan layer right there, and the outer cytoplasmic membrane. Okay, so we've talked a little bit about cell wall structures. Now, only gram-negatives contain LPS, or lipopolysaccharide endotoxins, within their outer membrane. Whatever, right? Wrong. LPS and endotoxin are a big deal. A little infectious disease integration here. The release of LPS is what causes septic shock. Hang on just a sec. What is septic shock? Do you remember the signs and symptoms? I'm thinking of fever, hypotension, tachycardia, and altered mental status. Endotoxins activate host immune cells and cause macrophages to release TNF-alpha, interleukin-1, and nitric oxide, which all cause massive vasodilation and severe hypotension. Shock is a really big topic, and we don't have time to cover it all here, but here is one more thing I want you to take away. In hypovolemic shock, which can happen after a major volume-depleted state, such as trauma or severe dehydration, what happens to peripheral vascular resistance, PVR? PVR will be high because the body has a massive adrenergic response. So, how will your patient look and feel? You may have heard the words cool and clammy. They will have cool and clammy skin. Cool and clammy, cool and clammy. If you see this on your test, you better think of hypovolemic shock, and you better start replacing volume. On the other hand, in septic shock, because the body has a massive vasodilatory response, the patients will actually feel warm and have flushed skin. Remember this key difference. Time for our first flash quiz. What component of the gram-negative bacteria contributes to the development of sepsis? Answer is lipopolysaccharide.